If you are an IMG GP that has just landed in Australia, well, you probably have three priorities. And the first one is not get bitten by snakes, the second one is not get bitten by spiders, and the third one is to understand this whole Medicare thing that everyone is talking about. Gone are the days of being paid on an hourly basis and complaining about how these 10-minute appointments are completely unsustainable in the NHS, where I spent the last 13 years. And now, say hello to the absolute mind that is Medicare, item numbers, and constant fear of audit. So let's lay down some foundations on how this whole billing system works in GP, and at the same time rest assured that most Australian GPs still find Medicare extremely confusing. Number one is, how do I get paid? Let's bring up a patient. Cherry Ripe comes to see you for whatever reason. You bring up her file, you go on to today's notes, and you do your usual consultation. As you can see here, there's a timer that's ticking away. Now what this basically means is, depending on how long you spend with Cherry Ripe, that is how much you can charge for that consultation. And the way that you do that is you use what is called an item number. You kind of write up your consultation and then you click on Finalize Visit. When you click on Finalize Visit, it will record what your visit length was, and you can choose a number here. Now when you're using time-based codes, there are effectively 4 time-based codes for straightforward consultations. A 3 means that the consultation was less than 6 minutes. A 23 means that the consultation was between 6 minutes and 20 minutes. 36 means that you have spent over 20 minutes with your patient. And if you are that kind of guy, you can even use a 44, which is over 40 minutes with the patient. And when you put in that item number and you double click, there will be a little bit of a description here in terms of what you have actually done for that patient. This description here is super important, because to be able to bill this number, you have to have satisfied the requirements that are in this window. And the information from this window comes from the MBS, which is the Medicare Benefits Schedule. And this is a website that unfortunately you will have to become friends with, because when you are finding out whether you can use a certain item number, well, you kind of want to go into the search MBS, click the hourglass, choose the item number you're interested in, and you do have to read everything here to understand whether you have satisfied the Medicare criteria. So as you can see, for a 23, which is the one that I was talking about, between 6 and 20 minutes, this is a professional attendance by a general practitioner lasting less than 20 minutes and including any of the following that are clinically relevant: the history, the exam, necessary investigation, in relation to one or more health-related issues with appropriate documentation. Let's go back to our patient. Now, if I put in 23, again, as you can see, it has brought in some of the information from the MBS. As I'm changing the number, the fee changes as well. So for a 3, if you're a private billing practice, the fee will be $62. Now, if you're doing a 23, the fee will be $100. The private fee is set by your practice. I'll go into a little bit more detail in a second. If you do a 36, it's $160. If you do a 44, it's $200 for the consultation. Now, I did signal constant fear of audit. As you can see, the program records how long your consultation was. So if your consultation was only 53 seconds and you're actually billing a 36, well, then you are at risk of triggering an audit. And we'll talk about that in a second. Now, let me explain a little bit why you are seeing two numbers here, 160 and 7970. This basically all pertains to Medicare. There's a bit more information about Medicare on this RACGP website. If you want to read a little bit more, I will include the link in the description below. But Medicare effectively is a public health insurance scheme that is funded by the Australian government, which provides all Australians that are eligible, of course, and that pretty much means that you are a citizen or a permanent resident, or you're from a country that has a reciprocal agreement with Australia. Medicare provides those people with free or subsidized access to healthcare. Now, let me give you an example. If, for instance, you come to Australia and you break your leg surfing, and you have Medicare, or you have that agreement that we talked about, you can go to any public hospital, to any emergency department, you get triaged, you see the doctor, you get your x-rays, you get your plaster, you get your follow-up in fracture clinic, and that is all covered through Medicare, which means that you don't have any out-of-pocket costs, which means at no point do you have to take out your debit or credit card and use the card machine that is in the hospital. Now, if you scroll down a little bit lower here, you have this bit on practice billing. So GP practices in Australia actually operate as private businesses. So they're not part of that hospital public health sector where everything is free. And when I mean free, I mean that the taxpayers are effectively funding your treatment. GP practices are different. They're businesses. And how they work in Australia is that every time you see a patient, your reception effectively gives them an invoice, gives them a bill, and says, listen, your consultation today is, for instance, $100. But Medicare will give you a little bit of that money back. And if we go back to the finalized visit window and I put in a 23, which is a consultation between 6 to 20 minutes, and you can see that Medicare will give the patient back $41.20. Now, the reason why you're seeing two numbers here is that most practices in Australia, and especially in metro areas, are private billing practices. So what that means is that patients do have to pay what's called a gap. So they actually have to take out their credit or debit card at the end of the consultation when they go to the reception to pay, and they have to tap on the card reader. That was a massive culture shock for me to see that we actually have card readers, and we also actually have cash registers at our practice. And then again, if they tap the second time, they can get the Medicare rebate effectively back into their bank account. Now, that doesn't apply to all practices. Some practices are what are called bulk billing practices. And bulk billing effectively means that the practitioner or the GP doesn't charge a gap on top of that Medicare rebate. And so effectively, if we were a bulk billing practice, we would change the account type to direct bill. Any number we would put in here would effectively be lower and would only show that Medicare rebate. So at this point, you're probably wondering, well, do I have to decide whether I want the patient to pay a gap or not pay a gap? And luckily, you actually don't have to make that decision, because generally there will be a practice policy, and patients will pretty much be informed of that practice policy every time they come to the practice. They will either know that this is a bulk billing practice or it is a private billing practice. And generally in good practices, the patients will be warned beforehand that this is a private billing practice and the doctor charges a gap. Now, things get a little bit complicated because I have personally seen that a lot of GPs will pick and choose who they charge and who they bulk bill or who they don't charge. And speaking to GPs, I realized that they might have their own special rules. For instance, they will always bulk bill other doctors or nurses or medical students. Or I've also realized that GPs try to assess how rich is the patient in front of me and can they actually afford to pay my gap. And if they decide that actually they probably aren't that rich, then they might decide to bulk bill. Now, this is completely overwhelming for me. So what I generally have been doing, and what I probably suggest doing when you arrive, just follow your practice policy. And then over time, you will get a sense of what you want to do and what you won't want to do. Now, the last thing I want to mention about this before we move on is that a lot of work has gone into helping GPs privately bill patients. And the reason being is that there has been a Medicare freeze for a long time. So that rebate, what I was showing you, that hasn't really changed in a while. And obviously, as we all know, inflation does its thing. And effectively what was happening is that with inflation, that Medicare rebate was worth less and less and less. If you want me to go into a bit more detail about that, we'll probably do that in a different video. So number 2 is, are there potentially item numbers that are worth more? And the answer is yes. So this is similar to the NHS, where you would have something called QOF. Effectively, if you had a patient with a chronic disease and you would, for instance, do their blood pressure every 6 months or every 12 months, and your practice would get an extra bonus from the NHS. Or if you reached a percentage of your patients with, for instance, diabetes, and they've had an HbA1c within the last 6 months. And a similar example was spirometries in asthma patients. So if a certain percentage of your asthma patients had a spirometry within the last 12 months, well, again, within the NHS, your practice would get an extra little bonus on top. So it's kind of similar in Australia. So if your patient, for instance, has a chronic disease and you create something called a GP management plan, well, then you can bill a 721. And as you can see, a 721 is worth a lot more than your standard 23. Obviously, nothing in life is free. And even though the description here in the window is quite short, the rules for creating a GP management plan are super complicated. And if I write 721 here, you have to click on the explanatory note to this category. This is effectively where the fun begins. There are loads of restrictions and loads of things that you need to do to be able to bill that special 721 number. And explaining how to do this is far outside of this short little tutorial, but this is something that you can learn once you arrive. So don't worry too much about management plans the first time you start seeing patients. Probably just focus on the time-based numbers, but do sit in with someone who is more experienced, who is doing management plans. Sit in with your nurses who can often prepare these management plans for you and understand exactly what they're doing and how you can make sure that you are Medicare compliant. Now, number 3 is, what are the risks? And I just finished off by saying Medicare compliant, because effectively that is the risk. So if you want to make loads of money in GP and you bill a 721 and you also bill a 723 for all of your patients, as you can see, that's a lot of money and you will be a millionaire very, very quickly. But effectively what will happen is that Medicare will be alerted to the fact that there's some pretty unusual billing activity here at this practice from this particular practitioner. They will either go into your notes or ask you to provide proof that all of those patients that you saw and that you billed a 721 and a 723 for were actually eligible for that. And again, based on what you're seeing here on MBS Online, if it transpires that you actually didn't tick all the boxes here to be able to claim that number, well, then you will have to give that money back. And effectively, there have been GPs in Australia who have had to give back that money that they inappropriately claimed for themselves for billing numbers without fulfilling the Medicare requirement. So that is what I was alluding to, the constant fear of audit. Now, the tricky thing is that it does take a lot of time to understand the MBS, and it does take a lot of reading. So you do effectively have to put time aside to read the MBS, understand the item numbers that most GPs are using, and the best way to do that is basically sit in with a few GPs at your practice, and then deciding whether you can use those numbers as well, and whether your notes give evidence that you are fulfilling the Medicare requirements. Now, the last thing we're going to talk about is the pharmaceutical benefit scheme. And it's kind of like Medicare, but for prescriptions effectively. So how that works is that if you are prescribing a medication and you follow the indications that are listed within the PBS, the Pharmaceutical Benefit Scheme, and that medication will generally be cheaper for your patient. Let me give you an example here. I did Google a drug that is much cheaper on the PBS, and then I clicked on this, what is the most expensive PBS medication? And it is this strange drug here, aflibercept. So the way that you would prescribe that on the PBS, as it were, is you would go into your current prescriptions, add, you find the medication that we're talking about, you click on the medication, and here you can see what the requirements are for this medication to be prescribed on the PBS. So as you can see here, there's an indication for which it must be prescribed, and it must be the initial treatment. When you go down to next, you put in the dose, which if you know, you would put it down. This doesn't seem like a medication that most GPs would prescribe. And at this point, if you are prescribing on the PBS, you click on PBS and it's automatically clicked for you. However, if you're prescribing it off license or for something else, you would click on private. And in that case, your patient would probably have to pay the full fee for this medication. And to know what the full fee is, well, then you go onto the Pharmaceutical Benefit Scheme website and you put in the name of the drug that you're looking for. So as you can see, the general charge for your patient is going to be around $30 as opposed to over $890. Now, a lot of these things will hopefully be explained to you before you start practicing. And the best way to do that is to probably sit in with a few different doctors and ask loads and loads of questions. And unfortunately, you will soon see that people have different answers to those questions. But I guess that is part of the fun of being a GP here in Australia. So good luck.